In the first few years of a child's life where they're in here all the time, and parents are very good about making sure they're getting their shots, and pediatricians are reminding them all the time, but then after that third year, they just come in once a year, and it sort of pitters out just because most kids are pretty healthy. Not all kids have trouble with adolescence, but there's so much change. They're trying to figure out who they are physically, emotionally, cognitively. Their bodies are changing into puberty and transitioning into adulthood. And there's so much we do at that annual exam that can be really quite helpful to the families. We'll check their vision and hearing, we'll check their blood pressure, we'll measure them. We'll also screen for things like depression and anxiety. If there is depression or anxiety, it's much better to be proactive about it. And sometimes I've had the experience of doing a physical exam with a young person, and the parents don't even realize they're depressed. And one of the things we do during the exam is actually give each teenager an opportunity to talk to pediatricians or their pediatric provider on their own. And I think because they do look like adults, you expect them to act like adults, but I think studies have shown that the frontal cortex really doesn't develop until about 24 years of age, which is the age that you can actually rent a car. So, I think their judgment is not always, even though they look like they're adults, their judgment is not on the adult level. They think of themselves as adults, but it's okay to set limits and have rules and be accountable to your family still, even though they're pushing to be free. The goal of all pediatric providers and pediatricians is to have our youth happy and healthy and make that transition to an independent adulthood.